It's amazing the things that you concern yourself about when you're hosting an event in which you have such big numbers. And we anguished a little bit at the thought, excuse me, we anguished at the thought of trying to move 450 people in 40 minutes. So congratulations to all of you. You made it and did your business and got back here. All right. Well, it gives me, again, a great pleasure, and forgive me if I keep saying that for all of our speakers, but indeed it is true. And it's certainly especially true for me to introduce Dr. Steve Blair, who I know is known to most of you here, as is our next speaker, Dr. Haskell. I've known Steve for many, many years now, and it comes as no surprise to you for me to say he has mentored me on so many occasions. I can't think of an important document that's come off my desk, to the extent that there are important documents that have come off my desk, that Steve hasn't reviewed for me and given me insightful feedback. He is, without a doubt, one of the most published individuals in exercise science. And Dean, it's been my pleasure for the past year to be doing a sabbatical with Steve at University of South Carolina. I've been to his home many times. I've been a guest of him and his lovely wife Jane many, many times. And each time that we've gone there, we've sort of worked hard and played hard. And a lot of people come up to me and say, well, I can't believe someone who's as productive and as published and travels as much as Dr. Blair could possibly do anything but work. He must work constantly. And I say, no, that's not true. I say, no, I can't believe it. Won't accept it, can't believe it. He must be writing papers every day, never takes time to do anything to enjoy pleasure. I say, no, that's not true. I have seen it individually. I have been there, and I have worked with Steve, and I have on many occasions, many, many occasions, been party to Steve at his home when we've enjoyed some good fun together. So it's always a special pleasure for me to be able to introduce Steve. As I said, he's a friend and a colleague, and I would ask you all now, please, to join me in welcoming Dr. Steve Blair.
Well, thank you very much, Bob. It's certainly a pleasure for me to be here. And I don't work all the time. I do like to have fun. And the fact that I ever publish any papers at all is due to the many years and the long history I have with many folks in this room, in Bill's case going back 40 years or so. I think I've published a paper with every member of the speaking panel today, maybe except Ron, but also with many others in the audience. And one of the most recent ones is from a master's student who's just defended her thesis here at Queen's University, Marianne Haro. So for you young academics, here is the secret of my success, whatever success I've had. It's find these really smart people and really dedicated people and just latch on. I mean, that's what I did. You know, Tim came to do part of his medical residency with us, and it took me about 2 days to say, I'm going to try to get this guy, and I'm going to make him work, and I'm going to ride along on his coattails. But anyway, thanks again, Bob, for inviting me here. I'm going to open with just a couple of sentences, really following up mainly Tim's and John's talk. You know, Tim talked about dose and exercise and the Drew study and various other things. John showed us results from his many elegant studies and analyses. But a topic that hasn't really been touched on much here today is how much activity does it take to prevent the initial weight gain? How much would we have to do to stop the obesity epidemic in its tracks? And that is not the 60 minutes a day the IOM recommended some years ago. Frankly, I think 3 10-minute walks a day, the consensus public health recommendations, the US guidelines, would effectively pretty much stopped the obesity epidemic. But that's an aside. That's not what I'm here to talk about. I am going to be talking about activity, fitness, and disease outcomes and mortality. Tim has already mentioned the ACLS. We've had the opportunity to follow this large number of patients for many years, and again, an important value of the ACLS is that they all have a maximal exercise test at the time of the exam, and therefore we have a measure of cardiorespiratory fitness. And as Tim has already said, this is an indicator of how active they've been in the weeks and months before they come for the exam. He showed you these data, I think, in a slightly different format, but again, the very large difference between the low fit and the moderately fit. And Tim had on one of his slides, how much do you have to do to be moderately fit? So here from several thousand men and women who were moderately fit on the treadmill, and I think Tim actually had this reference from John Stofan. But again, it's right at the consensus, 150 minutes a week. That produces moderate fitness that Tim showed, and I'm showing, I think he showed this slide also, is of enormous benefit, getting out of the low fit category. Well, after some of those earlier papers, in the mid-1990s, we began to think about looking at fitness. We always adjusted for other potential confounders, but think about comparing fitness as a predictor of mortality with other well-established risk predictors. And here you see for the women in the ACLS, the relative risk of the low fit compared with those who were at least moderately fit, the smokers compared with the non-smokers, and so on. Fitness actually is the biggest relative risk. Now, I'm sure this difference isn't statistically significant, but the fundamental point is inactivity and low fitness are as important public health problems as we face, beyond maybe the carbon load. And I have a friend who's one of the world's great sustainability experts. He said, but I think it's 2050 or 2090, or it's not that far in the future, although, Bill, you and I won't be here and we won't have to worry about it, that the world population